Happy New Year from Dr. Babymaker Burris. One of the things I wanted to chat about at the beginning of this year is that we offer DNA fragmentation testing for our patients. And this is really an important test, particularly for patients who the female factor has been either ruled out or we've regulated her and she's clearly ovulating every month and still not getting pregnant, or for the patients who have had multiple pregnancy losses and they've had testing done, both semen analysis and women's health, and everything seems normal, but they haven't had the DNA fragmentation testing done. This is also really, really helpful for failed IUIs and failed IVFs. We want to make sure that the DNA fragmentation of the male piece is under 30%, and honestly, ideally under 20. Oftentimes patients will be told, oh, well, we'll just do ICSI, which means they pick out the best sperm. The challenge is you're guessing at the best sperm. Clearly you can look at certain aspects of the sperm and clearly see the differentiation, but sometimes when you have that DNA fragmentation, you don't know. So if we could take someone from a 60% DNA fragmentation or a 38% and get them down to 17% or 21%, you're gonna have far better odds of picking the healthier sperm. So it's always best to have us prep you before IVF, both the sperm quality and the egg quality, and of course the uterine receptivity. But this is really important, and it is something that we can change. I was listening to this amazing podcast recently from these IVF doctors talking about DNA fragmentation testing, and some of them say they use it often. Others say they don't use it because they cannot improve the DNA fragmentation themselves. That's where we come in. We can, and we can prove it by testing. And that's such a beautiful thing to have those tests so you can show what it was before and after, and then you know it's time to try for that healthy baby.